Dr. Carson, as folks were coming in, we were asking some questions and wanted to make sure that we had an opportunity to grill you. You know, that is the New Hampshire tradition here in this primary. We always got to grill our candidates. But there was 3 questions specifically that were asked over and over and over again. The first of those were, given your passion and your lifetime endeavor at improving the education of our young people, what are some things that a president, if elected, would like to see done as far as education is concerned?
Well, you know, education is the great divide. Doesn't matter what your ethnicity, doesn't matter what your economic situation is. If you get a good education in this country, you can write your own ticket. And that's something that I think we have forgotten. Education has been such an important part of our history. And yet today, 20 to 30% of people in our high school do not graduate. That is a tragedy in the information age. Wasn't as big a problem during the industrial age or the agricultural age, when we could produce more washing machines and automobiles than anybody else, or more corn, wheat, and barley than anybody else. But it's a big problem during the information age. And yet, if you go back in time, go back to 1831, when Alexis de Tocqueville came to this nation to study America, because the Europeans were fascinated. They couldn't understand how a fledgling nation, barely 50 years old, was already able to compete with them on virtually every level. That was impossible. What was going on? He was going to come and he was going to dissect everything and figure out what it was. So first, he looked at our government, our divided government. He was duly impressed with how efficient our government was. Now, this was some time ago. And then he said, well, let me look at their educational system. And he was blown away. Anybody finishing the 2nd grade was completely literate. He could find a mountain man on the outskirts of society, and the guy could read the newspaper, could tell him how the government worked. You know, it was that kind of education that really made a big difference in this country. We had people who knew how to do things. That's how they were able to move from one sea to the other sea, across a rugged and hostile terrain. They knew how to build roads and structurally sound bridges and containment facilities and dams. They knew how to invent things when a problem arose. They had what's known as the can-do attitude. And that was one of the things that really made a big difference in this nation. Before America came along, 100 years, 500 years, 1,000 years, 3,000 years, it didn't matter. People did things the same way. Within 200 years of the advent of America, men were walking on the moon. If anybody tells you this is not an exceptional nation, tell them to go jump in the lake, because this is a very exceptional But if you really want to be impressed, take a look at an exit exam for middle school in America in the early 1800s to mid-1800s. What you had to do to get a middle school certificate. You can find some of those questions in our book, America the Beautiful. And interestingly enough, that was the first book that I wrote with my wife, QandA. And the second one that I wrote with her was One Nation, both of which became New York Times #1 bestsellers. So and that's QandA back there. But if you look in that education chapter, you'll find questions from the exit exam. And I think you'll very rapidly realize that the average college graduate today could not pass that exam. We have dumbed things down to that level. So now we must be in the business of re-educating America. Because particularly if you look at some of the multinational surveys, you know, we do very poorly, particularly in math, science, the STEM subjects, and we really need to change that. This maybe should be the focus of the Department of Education. I know a lot of people say we should abolish the Department of Education. I understand that, but let's wait until we get some good use out of them. And you know, there are computer programs, for instance, that can look at the way a kid solves 5 algebra problems, and based on how they solved them or didn't solve them, it knows what they don't know, and it can go back and tutor them on those subjects. The same thing a good algebra teacher can do, but the algebra teacher can only do it for one student at a time. A computer program can do it for many, many students at a time. That's how we get caught up. That's the kind of thing that the Department of Education can help with. Virtual classrooms. We can put the very best teachers in the world in front of 1 million students instead of in front of 30 students. You know, maybe they can also monitor schools that receive public funding for bias. And maybe we can start not having our schools be propaganda mills. And maybe they can So there are ways that we can use the government in a constructive sense. But for the most part, you know, the government is way too big. There's way too many redundancies. There's much too much overlapping that's going on. There's way too much waste. And what I've suggested in terms of government reduction is attrition. We have thousands of government workers that retire every year. We simply don't replace them. And we can move people from one place to another, particularly for critical positions. But if you do that for 4 or 5 years, you got a government that is trim and that is efficient. And that's what we're doing.
You're obviously a doctor. And so we're curious to hear your thoughts on Obamacare.
Well, you know, when I was an intern at Hopkins, I would go in the wards, and I would see all these very important people. You know, the CEO of this corporation, the president of this organization, queen, crown prince of this country, in many cases dying of some horrible disease. Do you know that virtually every one of them would have given every title and every penny for a clean bill of health? You begin to realize what is truly important that you have, and that is your health. And that is why I don't want the most important thing you have in the hands of a bunch of bureaucrats. It needs to be in your own hands, and that's why I rail so strongly against Obamacare. Not so much because it doesn't work, but because it opens the door for the government to control your life. And that's not what America was ever meant to be. Now, I don't like to complain about something unless I have a replacement for it. And, you know, I believe that the usage of health savings accounts will solve this problem very effectively. And if you look in the ACA, you will see that there is a section on health savings accounts. But it's a way to limit them and to constrict their uses rather than broadening it, because I think they realized that this would be big-time competition for them. Now, I would suggest that we make health savings accounts available to every American the day that they are born, and they keep them until the day that they die. And they can pass them on when they die to members of their family. So money just continues to accumulate over the course of time. Now, how do you fund the health savings account? Well, remember, before the ACA came along, 85% of Americans had health insurance and were happy with their health insurance. And they had a way of paying for their health insurance. Those mechanisms for paying for it still exist. We simply shift that to HSAs instead of to something that has a gigantic bureaucracy around it. Because with the With your health savings account, you're in control of it. 80% of your encounters with the healthcare industry is easily taken care of through your health savings account. It's really only going to be truly catastrophic things that you will need catastrophic insurance for. And the cost of that catastrophic insurance will be much, much smaller because virtually all the other things you're doing are coming out of your HSA. There may only be 1 or 2 times in your life. In many cases, there'll be 0 times in your life that you'll ever need the catastrophic insurance. So the cost really dramatically drops. The other thing you do is you make it possible for people to shift money in their HSAs within their family. So, you know, mom is $500 short for a special test. You know, her husband could give it to her, or her son, or her grandmother, or her uncle, or anybody who's in the family. Makes every family essentially their own insurance company. But also makes them very concerned about what people are doing in their family. So everybody kind of helps police what's going on in their families, but it gives you an enormous amount of flexibility to deal with situations. And then you've got your catastrophic care to deal with real catastrophic things. But the cost of it is so low, and particularly even lower when you make it possible for people to buy it across state lines. And you say, well, you know, that works very well for, you know, people who have good jobs, you know, they have a mechanism for funding their HSA. By the way, you can fund it any way you want. You could put your birthday money in, whatever you want. But you say, well, what about the indigent people? How is theirs going to be funded? Well, how do we take care of them now? Medicaid. What is the annual Medicaid budget? $400 billion a year. That's a lot of money. How many people participate? 1/4 of our population. About 80 million people. If you divide 80 million into 400 billion, it comes out 5,000. 5,000 for each man, woman, child on Medicaid. What could you do with $5,000? Concierge practice, the boutique practices that rich people join, usually $2,000 to $3,000 a year. So you can put them all in a boutique practice. And you still got thousands of dollars left over to buy catastrophic health insurance, which is much cheaper. Now, I'm not suggesting that that's what we do. I'm telling you we have enough money in the system to do that. But, you know, we spend twice as much per capita on health care as the next closest nation, and yet we have horrible access problems, terrible inefficiency problems. And if we take health care out of the political arena and just deal with it logically, we have much more than enough money to give everybody extremely good health care and access anywhere they want to go without a bunch of bureaucrats telling them what they can and cannot do. That really is the secret, putting it back into the hands of the people and the healthcare providers. The other thing you have to realize about doing that is it creates responsible behavior. You know, if you have a health savings account and, you develop a diabetic foot ulcer, well, where are you going to get it taken care of? You're going to go to the emergency room, and where it costs 5 times more to get it taken care of, or you're going to go to the clinic? Well, you know, right now, you have no incentive to go to the clinic. Then you would have a big incentive to go to the clinic. And look at what happens. You go to the emergency room, they patch you up and send you out. You go to the clinic, they say, now, Mr. Jones, let's get your diabetes under control so you're not back here in 3 weeks with another problem. So that's one way to save money. The other way is because you're actually interested in the balance in your HSA, you're not going to use it in a frivolous manner, and you're going to take care of your health because you don't want to be back getting services every time you turn around. So bringing an element of personal responsibility into the healthcare system will, I think, effectively save us an enormous amount of money. And those are the principles that should govern what we replace Obamacare with.
months ago, in an interview, you were asked if you were going to be running for president. And you replied with some version of, if you heard enough clamor. And the word clamor keeps coming up over and over again. So the question now is, have you heard enough clamoring yet? Or does this crowd need to stand up and make some more clamoring noise?
QandA and I are in 5 or 6 states every week, have been for the last year and a half, and the enthusiasm of the crowds has been overwhelming, I must admit. And you know, we announced our exploration committee at the beginning of March, and in 28 days collected more than $2 million. 40,000 new donors. Now, no one else can come close to those kinds of numbers. If that continues, and I suspect it probably will, then I would consider that clamoring actually turning into dollars. And that would be probably enough to convince me that people were truly serious, because you must recognize that the concept of someone who is not a traditional politician getting into a presidential race is not one that the establishment in either party is ready for. It is not something that the mainstream media is ready for. But I do believe it potentially might be something that the American people are ready for. Because I believe that the people are actually the strength of this country. And that's where the wisdom resides. And you know, that's what Thomas Jefferson said. He predicted that this would happen to us. He said we would go off the rail, we would stop paying attention, the government would become excessive, it would take over our lives, and that the people would rise up and save our nation. So thank you for that.
GrokTV.